Yeah, so I'm here to talk about the Information Innovation Office at DARPA, which funds a lot of work in computer science. So DARPA's raison d'etre is a little bit different from the National Science Foundation. We do fund a lot of research in computer science, but we don't fund the research in computer science specifically to advance the state of knowledge. We fund the research to solve a problem that is relevant for national security. And we do that because what happened on October 4th, 1957, which was the launch of the Sputnik satellite, it was actually out in the ether that it was possible for nation-state level activity. Then the resilient, adaptable, and secure systems. This is like using formal methods-based techniques and other advanced software engineering kinds of techniques to produce software that does what it's supposed to and guaranteed doesn't do what it's not supposed to. And this is about, one thing is reducing our attack surface so that those advanced nation-state level threats and the ransomware threats that are coming at us with various kinds of cyber weapons have less juicy targets to find. It's also about the process we use to certify that software is fit for use. A lot of Silicon Valley or software kind of, startup kind of software, you just like put it on the web and use it. But when you're talking about software that the government uses in high assurance military kinds of applications or in industrial situations, you have to have a certificate of authority to operate. And right now, the process to get that authority to operate takes years. So you can't have like, oh, I have this new idea or I have this new feature, I'm gonna go add it over a weekend, I'm gonna test it for a couple of weeks, and I'm gonna throw it out there. So this thrust area is partly about how can we take formal methods-based ideas and integrate them into an assurance pipeline or a process to get authority to operate that is based on the artifact itself instead of on the training that the people had who did it, or the company that they were associated with, or the color shirt they were wearing, which is kind of the process that is partially used right now. So artifact-based, formal methods-based, and then therefore possibly incremental. Then the top right category is proficient artificial intelligence. This is artificial intelligence that is understandable, explainable, communicating in human-friendly terms, that is not biased. You know, all the kind of things that we really want it to be, but it doesn't yet have this capability. So these are applications where, so like when you look at an application of a machine learning kind of technology, some of those applications are, if it gets the answer right, everybody's happy. If it gets the answer wrong, don't care so much. And so examples like this are things like, you know, adware or recommendations, or like a lot of the applications right now that startups that are making, you know, billions and billions of dollars, which is great, are that kind of upside-only kind of application. But where if it gets it wrong, it doesn't really matter. The Defense Department has a lot of applications where if you get it wrong, it really matters. So these kind of downside applications. And we could, you know, for the upside applications, the Defense Department could just go buy the technology from startups, that's fine. But for the places where the downside really matters, you could say, well, does it matter? Can we just not use this kind of technology in this space? But we have adversaries that are, China, for example, has a well-resourced, well-funded, well-thought-out plan to lead the world in AI by 2030. And that's across both upside and downside kinds of applications. So the role of I2O is to compete and to make it so that China doesn't get to proficient AI before we do. Because like Putin said in 2017, the country that gets to proficient AI first will rule the world, right? Having a country that has proficient AI compared to other countries that don't, that's like that country having nuclear weapons when the other ones don't. So we really, really, really want to have a country that has democratic values be in that position, or at least not be where adversarial authoritarian countries have that capability. So that's part of the office's charter, is to get that proficient AI. And then the last one is confidence in the information domain. This is focused on mis and disinformation, which is fraught for national security. Here, the four kind of sub-areas are awareness, so detecting when there are nation-state level mis and disinformation campaigns targeting populations. What are they trying to target? Why are they trying to target it? Finding it out at scale as fast as possible across many different social media channels. Figuring out how to counter such campaigns, how to measure the effectiveness of such campaigns, and how to inoculate the population, make us more robust as a society so we are less susceptible to nation-states trying to tear us apart from the inside. All while pursuing, maintaining our democratic values. Because if we do any of those things in a way that sacrifices our core democratic values, well, that's just losing in a different way. And of these four thrust areas, that's the one that keeps me up at night. I have only glimmers of ideas of how to do that. So if you have good ideas about how to do any of those, well, any of them all, but like that one in particular, I would love to hear about them. Okay, so what is DARPA? DARPA works really, really differently than National Science Foundation. DARPA, the sort of structure of DARPA is there are people, the program managers and the CITAs who run DARPA. All of the program managers at DARPA are on term appointments. Like my badge, which I'm not wearing right now, has an expiration date of 2 years. I could be reappointed for another 2 years and maybe for another 2 years, and that's it. After that, I have to leave. And part of that is to make sure that the organization is always refreshing, because the organization is focused on creating and detecting strategic surprise. And once you've been at DARPA for 4 or 5 years, the organization thinks they probably sucked all the surprise out of you, and you need to go back out into the world and accumulate more surprise. People do multiple tours. You can go back out and come back again, but you have to go out to collect more surprise. And then, as I said earlier, DARPA doesn't do the research itself. DARPA creates visions for programs and then puts out calls, and then people in the community respond. And that's academics, that's people in companies, it can be people in the military. DARPA calls those people performers. We could argue about whether that's a good term or not. It's better than contractor. Right, and there's strategy and culture, and I'll talk about those a little bit more. So program managers, right? DARPA also, consistent with its mission of strategic surprise, is a bottom-up organization. Organizations that are top-down are really only good for the surprise of the people at the top. So to counter that, ideas for programs, the starting programs come from program managers. And being a program manager is kind of like running a research group. Like when you're a professor, you run a research group of 4 or 5, 10 maybe students, postdocs to advance your research. When you're a DARPA program manager, you're running a research group of maybe 10 or 15 contracts, which each one of those contracts is like a company or university that corresponds to 10, 15, 20 people. So you're running a group of like 100 people across 10 different organizations. Some of them can be international performers. It can be really quite broad. And the advantage of that is you can have a really long lever arm. People who are program managers have like, there's this problem. We have to solve this problem. It has to be a problem that's relevant to national security. Here's a technical idea or a technical approach, or more likely a combination of technical approaches from a range of different kinds of disciplines or subdisciplines of computer science that, if put together in just this way, has a chance of solving or creating this technical surprise kind of area. And there has to be some glimmer of why you think it might possibly be true, like some evidence that you can actually do this. So an example that why that glimmer, the basis of confidence, is really important is, transporter technology from Star Trek. Now that would be fantastic. It would have tons of national security ramifications, right? It would change the world, lots and lots of strategic surprise if we could get transporters to work. The problem is nobody has any idea how to get transporters to work. In fact, I think the physicists would probably tell us you can't get transporters to work. So that basis of confidence is really, really important. So the program manager creates this idea, identifies a potential surprise area, potential technology, basis for confidence, and goes and pitches this idea to what's called Tech Council and asks for some amount of money, somewhere between, a low program might be $20 million, a high program might be $80 million. TTO programs, which build like airplanes and missiles, those are much, much higher than that. And they get told yes or no. And if they get told yes, then they go write a broad agency announcement, which is a 20, 30-page document describing what they envision. Now, one of the things that I didn't say is when they're coming up with this idea, the idea is almost always broader than their own area of expertise. So they don't just, the glimmer is their original idea, but then they go and talk to a ton of people, and they talk to people out in the community to help form the idea. So there's a lot of dialogue in creating these programs. And so if you're interested in working with DARPA, a really good strategy is to go look at the program managers who are currently at DARPA, particularly ones who don't currently have a program associated with them on the website, because they are 100% in the process of creating a program. And in that, they are interested in talking to people who have ideas about where technology could be solving problems. So if you talk to the program manager while he or she is ideating about what they might want to do, you can influence their ideas. And so when the BAA comes out, there could be a piece that is perfectly designed for your particular work because they know that your work exists and can fit in that space. So talking regularly with program managers is a really good strategy if you kind of want to work on problems that are relevant to national security with DARPA. As I said before, programmers do the work. DARPA doesn't have any labs, doesn't have any infrastructure. We put out these broad agency announcements, which are competitive public solicitations. They're usually on the street for 45 days, which is a very short period of time, right? So having previously talked to the program manager to know the general area, so you're already thinking about it before the BAA comes out, is a really good strategy. A lot of times, smaller organizations have a hard time working with DARPA. There's a lot more bureaucracy. We try to keep it as small as possible. We're trying to make it simpler, but there is more overhead. Also, DARPA, as I said before, doesn't care per se about advancing the state of knowledge. It cares about solving and creating this technical surprise. It almost always does create new knowledge in the process and likes doing that as a side effect, but it's not the goal. So when you write a proposal, you need to be focusing on what is the strategic surprise I'm trying to create, and how does the technology do that? Instead of, like, you sort of flip, like for NSF, you might say, here's the way I'm going to advance knowledge, and by the way, it's going to accomplish this. DARPA, it's I'm going to accomplish this, and by the way, here's how I'm going to do it. So both organizations care about both things. It's just sort of which one do they lead with in doing that. It's a really good practice. Like when you think about your own research, how do you normally explain it? Do you normally explain it, here's the tech and here's what it can do, or here's what it can do and here's the tech? It's a really good idea to be able to explain it in both ways. Almost everybody's research can be explained in both ways. And depending on who you're talking to, like know who you're talking to and explain it in that way. Right, I already talked about this. I've talked about this too. Yeah. I think I will stop there and I will leave time for questions so that you guys can ask questions about what's going on. I talked about this too, which is talk to program managers because they are the people who are key to working with DARPA. You can influence how they structure, how they think about their programs, including, like, you could be like, this is something you should be working on. If you're not working on it, you should start working on it. That's a harder lift than just like, I know you're working in this general area, here's a piece of technology that you should think about. And like my colleague at NSF, we are always looking for people to come to DARPA, right? DARPA program managers have expiration dates on their badge, which means we are hiring about a quarter of our program managers every year. So not right now when you are CIFellows, not when you're an assistant professor, but when you have tenure, one of the things you can consider doing is coming to DARPA and serving as a program manager, which is super cool because it gives you an opportunity to run a research project where you have like 100 researchers around the world who are really, really great at what they do. So it gives you a really, really long lever arm to let you change the world in really cool ways. And I will stop there. And I think we're going to take questions at the end, right? Cool.
I think they're pulling up my slides. Yep, they are. Just going to give her a moment. Wow, it's a lot of fun. What a great group. I'm Susan Gregorick. I'm the Associate Director of Data Science in the Office of the Director. So I'm not going to do a deep dive into what NIH's structure is. It can be a long conversation, a short conversation, but the mission goals are to promote health and well-being, to understand basic biology and improve our understanding of health and human services. So what I want to talk about is the intersection between data science and computational science and how this might relate to you and what might be interesting. But before I do that, I have to tell you about what our goals are, what our North Stars are for data science. So this is our vision. It is a strategic plan for data science. There's a about 20-page document that you can read, but the salient points are that we really look to support common infrastructures and architectures and specialized computational platforms. We're leveraging tools and technologies and capabilities from different sectors, from mathematics, from computer science, from industry. Our goal, of course, is to also enhance our nation's biomedical, data science, and computational science workforce through different types of training opportunities and programs and partnerships. My focus is on data, so we look at data sharing, data access, interoperability between data and data systems, and of course, always at the same time thinking about the security and confidentiality of patient and participant data, because NIH, although there is a component that is basic biology, there's a very large sector that's clinical research and patient-focused research, and so this is a really important point to note. We're always interested in ways in which we can capture, curate, validate, and store and analyze data in different infrastructures, and of course working with our communities to promote ontologies, standards, schema, different ways that we can think about harmonizing data. So my office is small, but we work with over 200 fellows at NIH and 23 institutes. to coordinate and modernize our biomedical data ecosystem, to enhance and create a strong and talented data science workforce, and to build strategic partnerships, which I'll talk about. You can see it in a different way. This just tells you some of our main elements of what we're interested in terms of infrastructure, modernizing data and data ecosystems, promoting data management, analysis and tools, developing a workforce, and then there's a component on sustainability. And if you're not aware of it, we do have an NIH data management sharing policy, which will go into effect on January 25 of 2023, which will say that all NIH applicants who are interested in funding must submit to us a data management and sharing plan, similar to what you do at NSF, but much more lengthy, telling us about the data types, the formats, the metadata, and where you intend to share it and how you want to share it. And if you're not going to share it, why you're not going to share it. So it's going to be quite a plan. So it's been said that if data is the new oil, then software is the refinery. So let me tell you, drilling down very specifically in what we're doing in the computational sciences, because I think this is where you'll resonate the most. And to do that, I have to acknowledge and thank my partners at NSF. We have a joint program at NSF. It's Smart and Connected Health for Data Science and Artificial Intelligence. Our goals are to increase our computational science capabilities at NIH. If you're familiar with NIH, all of our review panels are primarily staffed by biomedical researchers or clinicians. You will rarely find a computational scientist on those panels, so that translates into the lack of actually cutting-edge computer science applications at NIH. But we have a partner agency that has a whole division on computer science. So our partnership is really to accelerate computer science, information science, engineering, to support and transform health and medicine. So this just shows you the amount of awards that we're making by our institutes. Each institute has a different focus. There's a cancer institute, there's an aging institute, there's a library institute, a mental health institute. All of our institutes partner with NSF through my office. I'm the conduit of partnership. I also co-fund all these applications. Most of the applications that are coming in, and all your applications do go to NSF, and you do format these for an NSF review because NSF does the review. We'll focus on AI and ML, sensors, wearables, imaging, electronic healthcare records. These are just some of the things that have been funded, and you can see, of course, the big push right now for us and for NSF is artificial intelligence, machine learning. You can cover any kind of disease you want, cancer, mental health, brain, skin diseases. We do fund everything, but you can see where the priority right now is in nervous system diseases. And these data are pre-COVID, by the way, so there's going to be a huge spike now in understanding communicative diseases such as COVID and other types of diseases. So I want to just show you a snapshot of what's been awarded, only so that you see a use case. These are 3 different investigators from different parts of the country looking at different types of applications. And this just gives you a use case of what types of things we're looking at. You can find each of these awards in our reporter system. It's really impactful for you to go and look and see what's been funded as you structure your grant. So Rong Wang at Illinois Institute of Technology is developing a rapid and user-friendly, low-cost point-of-care device to be used in the dental office. This actually is integrating, dentistry is a really fascinating field for data science. The data are highly identifiable. They're kind of different from the other medical data. There's no interaction or little interaction between electronic healthcare records and dental records. So there's just a whole bunch of problems. He's looking at and integrating different types of diverse data, including images, proteomics, not genomics, just proteomics, for the understanding of craniofacial biology diseases. Timeng Liu at Oklahoma State is developing a non-image-based artificial intelligence tool for physicians who can quickly identify patients who might be at risk for diabetic diseases and also have renal pathology. So he's looking at comorbidity data so that he can help physicians recommend different types of screening for patients who might have diabetes when they're in their ophthalmology exams. And Hangyu Li at Arizona is developing, this is kind of cool, it's actually a device, it's a smart shoe that will integrate different types of sensor and actuation data so that he can understand and alert folks who might be at risk for ankle injury. So really different types of applications, all highly computational. There are other opportunities. Oh, it looks like my slide kind of looks a little funny. I can get you these slides. For folks who are interested in computational science and want to partner with different institutes at NIH, there's a really nice call for R01. That's our sort of our standard investigator grant. That's usually what most people come in on, to support computational studies, molecular dynamics studies of HIV. This is NIAID, and what they really want to look at here is multi-scale MD. So if you're looking at everything from high-resolution atomic molecular dynamics, maybe have some QMMM in there, and you also want to scale that out to the whole virus or maybe half of the virus, this would be a program that you would want to think about applying to. There's a new program that I'm also co-funding, an educational hub for enhancing diversity in computational genomics data science. We're looking for a data hub to really target education and data science in diverse communities. And so this is a program that is a pretty large program. It's a U, that means it's a center award. So you want to come in if you are interested in genomics, data science, computational data science, and also in educational opportunities. And finally, if you're interested in proposing workshops on computational analytical methods, there's an R21, which is a workshop program for you. We're looking for folks to look at programs that support activities in meeting the needs of biomedical behavior and clinical needs. I think this is supported by most of our institutes and centers, so you can propose a workshop on many different types of computational activities, and you'll be able to get funding. Lastly, I want to tell you about a way that you can give to NIH. The deadline is now pushed back till June 8th. So unlike DARPA and unlike NSF, NIH doesn't have rotating programs where academics and industry colleagues, people from nonprofits, can come and spend 2 years at NIH. It's almost all federal service employees who spend their whole life at NIH. I've been there for 10 years now, I believe. So many of us spend most of our lives at NIH. It's a wonderful place. But this program, sponsored by my office, the Data and Technology Advancement Program, brings colleagues in from academia, from industry, from nonprofit, even other federal agencies, to spend 1 or 2 years sabbatical working in high-profile programs that are very challenging. You'll see the programs we have this year, looking at interoperability of eye data, creating, and very importantly, AI-ready data for pandemic response and preparedness, looking at ways, looking at ways in which we can, looking at ways in which we can improve and automate consumer health information. A challenging program for us is integrating wearable data, such as data from your Fitbit or your watches or your sensors, into our electronic healthcare records. There's almost no standards for that type of data. It's very heterogeneous. It's a really hard problem. This is something we'd love to have an expert in this area come and work with us. It's this focusing on the cancer area. And then we have another program on multimodal cancer data integration, lots of interest in AI for genomics, lots of interest for AI in medical imaging, and particularly at the Institute of Engineering and Medical Imaging. And then we're also interested in folks who want to work with us on partnering with industry on a systems biology program to address diseases. This is a snapshot of our scholars this year. Most of these colleagues do come from academia, but not all of them. So Dr. Anna DeSales-Mays comes from academia. She's now working on ways to integrate data between the Kids First data platform and an Includes data platform. So integrating data platforms, creating research data mesh is something that's a high priority for our agency. If this is an architecture problem that you're interested in, you can certainly think about coming to NIH. Dr. Laura Clark is looking at developing outreach materials for codes developed at the National Institute of Environmental Health Sciences. Dr. John Gachago is in my office. He actually comes from small business. He has his own company, and he's coming to help us with a really great program. It's called Aim Ahead. It's an artificial intelligence and machine learning program to help address health disparities. We work with communities of underrepresented groups, and so he's working with us on that. Dr. Prishna Ghosh is working on probably one of my favorite programs. We have over 50 petabytes of genomic sequence data in 2 to 3 clouds, Amazon, Google, AWS. It is very hard to find data and search across 50 petabytes of data. I would challenge you to try to organize and find and think of really fast, efficient, and scalable search algorithms. This is her project, working with us in the National Library of Medicine. Dr. Janelle Sankjak is working with the NCATS Institute on integrating data across 7,000 different rare diseases. Rare diseases are tricky because there's just not a lot of data, so you have to work with very limited data sets. And Dr. Ansu Chatterjee is working with all of us, and he's looking to integrate electronic healthcare record data with different types of social determinants of health data in a way that could provide record linkages. So this is also a new area for NIH, looking at privacy-preserving technologies, so privacy-preserving record linkages, something that may be of interest to you as well. And finally, my last slide, we do host a data sharing and data reuse seminar the second Friday of every month. We have a lot of really interesting folks who come. They're all NIH awardees. Some of them are also NSF awardees, maybe even DARPA awardees. And they tell us a little bit about ways in which they're creating tools, methods, computational capabilities that focus on data. And so Dr. Piyush Katari from Stanford told us about the ways in which he's scraping data from many, many different open data platforms in order to address different types of clinical prognosis. So it's a great seminar. They're all recorded, so I do encourage you to look at his seminar. And with that, that is my last slide. We work across NIH to create a modern and integrated, fair biomedical data ecosystem. And thanks.
Thank you. I hope you get a taste for different types of work that can be done with agencies here. Now, just to give it, we do have about 10 minutes for Q&A with this panel, but I want to stress, try to keep these questions more general, because after this, we're going to go into smaller roundtables. So if it's a more personalized question, specifically working, try to save that for the smaller group. But in this group, that's just my direction. Go ahead.
Hello. My name is Morgan Turner. I'm from the University of Minnesota. Thank you very much for sharing all of this fantastic funding information. I think it's very valuable for us to understand how we can support our research. A big theme that we have all experienced here is just how important interdisciplinary research is in computing and how fundamental that is for expanding the computing research ecosystem. But also in my conversations with many of the fellows here, we all are very transdisciplinary researchers. We come from expertise in one field and we're gaining it in another. And we're drawing across these different fields to actually drive many different research questions all at once. And so my question is, what is your advice for us? Where do we apply for funding? Are there certain programs that can really be supportive of researchers like us that have many thrusts at once? Thank you.
I'll get started on that, which is that, the research we're looking for is described in the solicitations or the calls for proposals. And we're not looking for people who have a degree in a certain thing or that come with a certain label when we support projects. We're looking at, what is the contribution it's going to make. And, like I talked about, we have some programs that are kind of intended to steward the disciplines we think of as computing itself. And we have a lot of programs, and in size, half our budget goes towards programs that are explicitly intended to bring together folks to work on, we at NSF, we call it convergent research that brings together different strands into something that's truly integrated. So, like I said, work on the problems that you think are important, that you think are going to make a contribution, make the world a better place, that you feel passionate about, that you feel like you can make a contribution to. Find collaborators who have complementary expertise who are going to help you achieve that, who you can find a common goal you work at, and either talk to us, interact with us, and figure out, what is the right opportunity at the agency to give you the resources you need to do that. As an agency at NSF, we do see part of our the role we play in the enterprise and in the ecosystem is to be a place where people can bring their idea, no matter what it is, no matter what its intended application is. So we have programs that are intended to be broad and stable. At the same time, we might have programs that are more focused or have more of a goal because we're looking to stimulate the community. It might be in fairness in AI or on climate or some other grand challenge. And Susan or Kathleen?
I could say so. As I mentioned before, DARPA is focused on solving a particular problem and doesn't care particularly about, cares about the plausibility of the technology. So the argument that you can make about why the idea or the set of ideas will be, has promise to solving the problem, but is quite open-minded about the range of technical skills. And in general, the problems are almost always phrased so that they're across multiple disciplines. And so the program ends up having a whole bunch of different kinds of backgrounds. And sometimes those are, a single person could be bringing more than one expertise. I do think one piece that goes into funding decisions and in general paper acceptances too, there's a reputational component, maybe more in funding decisions because now paper submissions are usually double blind. And so when you're doing the cross-disciplinary, transdisciplinary kind of work, a thing to strategically think about is where is my reputation, what is my reputation in each of the different communities? And maybe it's strongest in one because that's where I came from. What can I do to build up my reputation in other areas? And maybe that's going to conferences and workshops and talking to people, submitting workshop papers, kind of building up your reputation in the other areas so that when people see your name, it's like, oh, right, I know that person, she does this and that. Because I do think that the trust and the reputation plays more of a role than is maybe obvious at first in various career kinds of related things.
So I can further give some more advice. I am a computational chemist by training. I can talk to you a lot about reactive dynamics and calculation of fluxes and spin state complicated reactions, but I digress. So what I would say is when you're an assistant professor, cast a wide net on your funding opportunities. My first grant was from the American Petroleum Foundation. It's kind of a small little niche group, but it's a good starter grant, so look for those opportunities. But know what your funding agency wants. What are their priorities, and make sure that you're writing your application to address their priorities. You're doing your own research, but you gotta address their priorities. Have mentors. Ask people to read your grants, and don't be afraid. Your old thesis advisor or postdoc advisor, ask them to read your grants. Senior faculty members in your department could also be good mentors. Partnering with others is a really good opportunity, especially if you're in a team science environment, which I always enjoy. However, know your department well. Some departments are very open to those partnerships, and other departments are not, and you really got to know what the priorities of your tenure committee are going to be before you embark on a long team-based science initiative.
Thank you.
Hi, Thaisa Kushner from CIFellow at Oregon Health and Science University and formerly University of Colorado Boulder. I actually have an interdisciplinary question about DARPA, NIH, NSF. So my work is in safety critical cyber-physical systems, except for biomedical devices. And the classic funding route is a lot of DARPA money for more of the autonomous vehicles, aircraft space there. And then the smart connected health between NIH and NSF is great, but it's more a limited pot of money with not a lot of focus on the formal verification. I'm wondering if there's any future potential areas that might be going more of the health, NIH, DARPA, NSF kind of where to fund these safe medical devices that kind of span the three divisions.
Maybe I can take that. So there's some good news for you because you're right. You cleverly realize that smart connected health is a limited pool of money.
Yeah.
And so it's competitive
Yeah.
at both agencies. Although I will say that you get 2 bites of the apple. You get the bite of the NSF funding and separately the NIH funding, because we don't co-fund. We take the pool of applicants and we partition between the 2 agencies. So there's 2 opportunities there, but it's not a large amount. So NIH recently was authorized for our ARPA-H, which is DARPA-like, but for health.
Yeah.
And Adam Russell is now the acting deputy director. He's going to be setting this agency up. There'll be lots and lots of really creative and innovative ideas that mirror what DARPA does, but really for the health sector. This is going to be great. There's a $500 million, I believe it's $500 million for the next several years. So, I would say definitely this is an opportunity for everybody here to start thinking about that. There are other programs at NIH that do think about the types of work that you're doing in devices with focus on validation. They tend to be more in the NIVID space, in the cancer space, and I can point you to my colleagues. Mariah Bitterman, I think, is the one who really comes to mind, and her program is really focused on these types of devices. There's also a partnership with both of those institutes with FDA, because our goal is a pipeline approach. We not only want to get those devices built, we want to get them in the hands of patients and doctors. This is a big push for COVID, where we had a huge program on diagnostic technologies. It really shrunk that pipeline from maybe 6 or so years to 6 months. So it was a good accomplishment for our agency.
I'll just add that, formal verification for cyber-physical systems is, potentially a topic that's of interest to a cyber-physical systems program at NSF. We're looking for, you've heard this phrase like again and again in the last 2 days, high risk, high reward, something that's going to be transformative, that's really going to move the state of the art forward. So, if you feel like you have an idea like that, if you feel like you can make the case for that, how this is really going to advance, make an advance, and that's going to have this impact in medical devices or in health, that's the kind of case you would want to make to an NSF program.
So DARPA works in programs, right? So there may be a program that comes, this is an area that would be something that my office would do if there was a program manager who really wanted to do it and could make the case for what we would learn in a transformational way again. There are program managers who are working in high assurance for embedded systems kinds of applications. It wouldn't be a bad idea to reach out and talk to them to get your name on their list. So if they start to think about biomedical kinds of devices, it might be that such a thing would be a use case on a program that was doing a whole bunch of different things. So reaching out and talking to them would be a good idea. So one of the rules for DARPA program managers is that they're supposed to take a meeting with anybody who has something interesting to say from a scientific background, not the people who have there are lots of, I get email on a weekly, daily basis from, I can solve the world's problems. I have my own tinfoil hat kind of, so they don't have to take meetings from those kinds of, but if you're like, I'm a professor, I want to talk to you about this kind of a thing, they're supposed to give you half an hour. If you send them mail and they don't respond, please send me email and I will have them respond.
Do you know?
I'll just add that, this topic of security of cyber-physical systems, we had a whole panel on that yesterday, and specifically about medical devices. So this is clearly something that's on people's minds, and that's really important.
Okay, Ben Greenman, Brown University. Yep. One quick question, because I've gotten conflicting advice about this. Should I try to take my point of contact out to dinner?
At NSF, no.
Same at NIH, it's a conflict, and you can't do that.
Right, you could go out to dinner as a group and each person pays for their own meal, but it needs to be not a smoozing kind of dinner.
Okay, thank you.
Hi, my question is about DARPA specifically and about surprise part. So it's been puzzling to me. It seems like the programs and the research outputs are in the open. So once they're done, it seems like external and international entities can take advantage of that as well. So how does it help with the surprise part? And since DARPA doesn't have its own labs or research stuff, does it transition somehow directly to some government labs, or how is this organized?
So DARPA pays a huge amount of attention to transition So like in fact, on the slides, it says, success of a program is transition, although what it transitions to, it can transition to commercial use, it can transition to partners within the government, it can transition to the military. Like, depending on the program, there will be different kinds of notions. Some of the times it's changing the mindset. So like the HACMS program that was about high assurance software for vehicles, it was really just changing the mindset from formal methods isn't useful to anything to no, formal methods can make software for vehicles be such that a red team can't break into it. So part of the, if it's all, so DARPA does classified work, so not everything that DARPA does is in fact released out to the public. And for those programs, it absolutely has to transition to partners who are also on the classified side. And if it doesn't transition, it was, most of that information was then lost. So unclassified programs, you can advance the knowledge, papers get published, maybe the idea was just too early, and so you get the reward 10, 15 years down the line. But on the classified side, you don't publish the paper, so you have to transition or the money was mostly wasted. In terms of like what's the strategic, how is it helpful in an adversarial setting to have strategic surprise if you're publishing the work as you go along? The idea is that because we're developing the work, we have an edge of some number of years because the technology was like, just because it's published, it doesn't mean you can go turn on the spigot and understand how to use it immediately. So it's a time advantage of some amount of time.
Oh, great, thanks. So there is some work on transition then. That's good.
Yep.
Everyone can join me in thanking this panel. It's wonderful. I'm super quick. So I'm gonna kind of shift modes, and I'm doing this slightly backwards, but I'll explain why in a moment. So I'm gonna start with a couple of thank yous. This is not the official wrap up of the day. The day does go until 5, but I'll explain why I'm doing it backwards. First off, and I guess the slides are taking a few minutes, but that's okay. I wanna thank the cohort building committee. They really have helped me bring together this day for you all, and when we do the online virtual events, and we are going to get back to those every 2 months or so. So please, everyone who is helping leading the panels today, Bobby, Aruna, Ifioma, and Brian, they're the people I bounce off of to try to bring programming for all of you in your states, remote states, wherever you are. So please do thank them, and I want to thank all of them for working with me. The CIFellows PIs, you've met most of them today. Ken and Randy both had really good reasons why they couldn't be here, but sent their regards. But yeah, these are the people who really worked behind the scenes to bring this whole program together. So I want to thank them. And I would like all of you to thank them when you see them as well. So hopefully, thank you to all of you. I couldn't do it without you. I also want to thank the staff, the CRA staff that has been working behind the scenes. You've seen some of them, some you haven't even seen. Some have had no involvement in this program whatsoever, but showed up just to be extra hands here today. So to Haley, Kat, Maddie, Sandra, Sabrina, Tanaya, Daniela, Alejandra, Brian, and Peter, and everyone else, just thank you to everyone. And there's other stuff that they do behind the scenes for the program, so it's really is a team effort. So I really appreciate that. Really, as said it before, I'm going to say it again. I think we all need to thank the National Science Foundation for so many things they've helped us with along the way. And they do fund 80% of computer science basic research, so it's a good thing for us all.